What is the essence of the Wolfheze workshops? Central is the realization that TB elimination anywhere in Europe could not be achieved if it wasn't achieved everywhere in Europe. Paired with a strong belief in the strength of a movement, committing to reaching this goal together, finding unity in approaches. While the political storms were blowing overhead, the Wolfheze workshops developed into a safe platform to update each other on what was achieved, showing what worked and discussing next steps, moving together towards a Europe free of TB.
The movement came about at a time when tuberculosis was rearing up its head again after several years of steady decline in a European continent facing political upheaval. From Western industrialized countries to Eastern Europe and Central Asia, national health authorities were expressing their concern about the TB situation. Wolfheze was instrumental to the creation and strengthening of this community of European TB practitioners, giving them greater visibility with the help of key technical agencies like WHO, ANCD, the Union, and ECDC.
The workshops are a unique forum for multi-sector stakeholders to gather, share best practices, discuss achievements, and agree on very pragmatic ways to establish fit-for-purpose TB responses. Today, we are building on previous workshops and experiences of generations of national TB program management focal points.
In that two-day workshop, fundamentals and applied science was being discussed. The discussion could be heated, but remained friendly and respectful. And that to me has been the secret of the effectiveness of the Wolfheze workshops. An informal meeting of experts, each defending his or her own opinion, but always with respect for the opponent and in a friendly atmosphere.
I would say that Wolfheze meetings played a crucial role for the program, National TB program, and also for those people who are involved besides the TB program in work with tuberculosis, like Ministry of Health or different allied professionals. And that was really good possibility to meet colleagues from the same field, to share experiences and also to share maybe what is not going very well in a country, but mainly share best practices and be uploaded with newest information in tuberculosis field, like in diagnostic, treatment, management, and etc. things.
It's a great way of bringing people together, experts from all over the WHO European region, and to discuss experiences, to discuss what they have learned, and also to discuss the way forward. And it has really helped, in my opinion, to harmonize TB prevention and control in our region.
For me, the best lesson learned from those workshops is that professional discussion, exchange of knowledge and sharing experiences in implementing several guidelines or recommendations of either WHO or ECDC is the best platform to improve TB control in Europe, and that cannot be replaced by any other means.
The Wolfheze workshops were fundamental to spread knowledge and exchange information among countries. It was the realization that European countries must work together to control and eliminate tuberculosis at continental level.
Wolfheze has played a crucial role to make a bridge between East and West, North and South, between researchers, scientists, laboratory experts, national TB program managers, academicians, and health officials to basically move towards eliminating tuberculosis in Europe. It has brought a lot of good ideas, good views, and good suggestions, a platform where all ideas are welcome. Thinking out of the box is stimulated.
According to what I was told, I am together with Jaap Veen the only survivor of the Wolfheze 1. So I have here a present that was given at the time to all participants. And this is, I think you can read it to testify that this was the original from 1991. I have the entire collection we keep in the house. Wolfese was at the beginning thought to be something different from what is today, and was seen as a think tank, let's say, for future visions. And basically, it delivered the concept of TB elimination. So Wolfese 1 was very much a meeting of experts. There were some 40 experts from low incidence countries, so also from USA, from Canada, from Japan. And it was seen also as an opportunity of training for young, promising young people. Then this meeting was strongly, let's say, conceived and pushed by the, at the time, president of the Union European Region, Professor Eero Tala, together with KNCV. So Jaap Broekmans at the time was the director of KNCV, and Jaap Veen. And at the time, there was no ECDC yet, it didn't exist. And there was not yet this surveillance project, de la Veille Sanitaire, this project of the European Union, which was kind of a product of Wolfese.
What has changed in the 20 years? Well, one important thing I believe is that civil society has become a participant of the Wolfese movement, and that's greatly appreciated and really, really important.
I often think back with a lot of sentiments to the 1990s when Wolfese began. At the time, in 1994, at the second meeting of Wolfese, and I do remember well the discussions on the crucial decisions to invite Eastern European and Central Asian countries for the first time ever, so that they could sit together with Western European colleagues and discuss common themes. Elimination was the theme of the first Wolfese. Here, we were talking of other themes, of crucial themes. That was the beginning of a movement which ended up providing, I would say, the basis for all discussions on coordination, on cooperation, on common standards, on definitions among countries that until then did not have a place, an opportunity, an environment to dialogue so effectively as the environment that was offered by a place like Wolfese.
An early realization in the early 1990s was that the data to track what was happening with the TB burden in Europe was poorly standardized. A series of discussions leading to key consensus publications helped standardize much of the methodologies of TB surveillance and TB treatment outcome monitoring that we use today. That was followed by other useful agreements on several other aspects of TB prevention and care. The long tradition in standardized approaches to TB surveillance and practice gives TB a distinct advantage over several other public health concerns of global magnitude.
Actually, there are many achievements. The movement was among the first to bring various stakeholders together. And then over the years, it has helped advance regional priorities, such as addressing drug-resistant tuberculosis, cross-border TB, access to new drugs and treatment, policy packages to eliminate TB, and involving community-based organizations and civil society, very crucial. This willingness, this enthusiasm to work together, despite different backgrounds and cultures, has helped overcome long-standing controversies. It has also stimulated the commitment of European governments to standardize definitions, reporting systems, and data provision to a common European database. Through the workshops, we have learned that harmonized interventions can help to improve TB responses across and far beyond national borders. Importantly, we have understood that direct dialogue with national TB programs, partners, civil society, donors, and bilateral partners must be maintained, both to welcome the growing number of participants but also to tackle challenges we see on the far horizon in the increasingly complex context of global health.
To me, harmonization of interventions and standardizations of surveillance are part of the biggest achievements of the Wolfheze workshops. What went on behind the scenes was a kind of diplomatic hurricane. With a colleague from the Dutch Public Health Institute, we traveled in 2 weeks' time to 14 capitals of EU countries to convince government representatives and national TB experts that harmonization of interventions was needed to achieve elimination of TB in Western Europe. This was not easy, but even more difficult was to persuade countries to accept standardized surveillance. Especially treatment outcome monitoring was unexpectedly resisted by some larger countries. But it led to the establishment of EuroTB, which in due time overcame most obstacles.
I would say is the biggest achievements of the Wolfheze workshops is unifying the TB control in the whole European region. The best support that the European region received from the Wolfheze movement was the support in standardizing surveillance definitions and recording and reporting systems so that we started speaking the same language in the whole continent.
If you're asking what would be one of the key achievements of the Wolfheze movement, I would like to refer to minimum package of cross-border TB control and care, where actually Wolfheze played an important role to prepare this consensus statement on what needs to be done to address TB among migrants.
No doubts that Wolfheze movement has played a tremendous role in the strengthening of TB control and surveillance in Europe. I remember very well my first participation at Wolfheze workshop in 1996 in Noordwijk, the Netherlands. But my close involvement in Wolfheze workshops has started in 2000 when I became WHO Europe regional advisor on TB control. KNCV, the host and main organizer of Wolfheze workshops, became one of the main partners in TB control.
First of all, surveillance is data for action. I say that because I am an epidemiologist, but I'm really convinced that it makes the link between the science and the public health action. Surveillance has no meaning without translation into action. And it's exactly what happened in Wolfheze. Public health action resulted from many, for example, from the recommendations that were elaborated in the Wolfheze meeting, started in the Wolfheze meeting. For example, the new surveillance framework. And I saw how it was successful in convincing France, for example, my own country, to change their surveillance framework for TB after the participation in the experience of the Wolfheze meeting and adopting the recommendation, including, for example, the link with the laboratory, the country of origin that France would never accept to report before. So it was really an experience. It also, what is very important in the Wolfheze meeting, it is gathering not only people responsible for surveillance, also clinicians, and it's also very much based on the KNCV experience, and the TB control authorities. A unique place to have all those people contributing together.
For us at KNCV, organizing the workshops together with WHO and ECDC is an honor and a pleasure, and we are committed to keeping up this effort for as long as relevant, till elimination is achieved.
The prospect of TB elimination remains hugely relevant today in Europe and elsewhere in the world, as we recover from the disruptions of the COVID-19 pandemic and enter into a catch-up phase. I hope that the spirit of solidarity and concerted approaches that the Wolfheze movement has inspired in the last 3 decades will keep growing into the future to help us overcome the challenges that we will continue to face, both old and new.
So if I would say something for the future, so I considering to invite countries which in the meantime made a rapid trajectory towards TB elimination. Like, for example, some EMRO countries. With the Gulf countries now have done a strong project to pursue TB elimination with political commitment, with a real action plan and a specific plan on TB elimination that Europe does not have.
Moving forward, my hope is to see two separate yet interlinked tracks. First, an expanded program committee to ensure better representation of both high TB priority and low middle incidence countries. The steering committee of the WHO European Ministerial Forum, All Against TB, under the auspices of WHO Europe, can create a link to the Wolfgäse workshops, using the movement to underline country commitments to the famous Berlin Declaration. Second, I hope to see a movement that serves as a think tank for modern policies and practices in TB control. This, I believe, is the best recipe for further progress towards elimination.
My hope for the future is that Wolfgäse workshops will not stop at thinking, but with input of all expertise will continue to translate this thinking into practical implementation. And it will include the new challenge to TB control, like COVID-19. TB control in Europe has been harmonized. COVID control, unfortunately, is still far from being harmonized. The Wolfgäse workshops can play a role there. You may have started to do so in the last 2 days.
I think to continue that support to professionals across the continent, and to continue those discussions on how to improve TB control in all the countries towards reaching the targets for TB elimination.
The thing is, we should have young people joining the movement and also provide their ideas and their experience to the Wolfgäse movement. One important thing thereby is also to use the technological advances that have happened in the last in all this time that Wolfgäse is already running, and use that to either have sessions, to have discussions, and also to reach further consensus on other things that are important to us all.
You know, Wolfgäse is a 3-decade-long project that has changed European policies and practice in tuberculosis care and control. Holding it regularly is a must if progress has to continue and if coordination is still considered an essential value to foster progress. I just wish it could be held in the village of the original Wolfgäse, since that was a truly magic place in the history of the fight against tuberculosis.
I would highly recommend to keep the momentum alive, to make sure that these bridges are staying strong, and also to think out of the box and to come with new ideas and new ways of working to end tuberculosis together.
I would like to mention that a lot of progress has been made during recent years, owing also to the Wolfgäse movement. However, TB and multi-drug resistant TB is still one of the major threats worldwide and serious public health problem in Europe. In addition, we faced recently with very serious challenges in TB control, such as COVID-19 epidemic and international migration, in particular from Ukraine. And I believe that Wolfgäse workshops will continue to join countries and strengthening international collaboration towards the end of tuberculosis.
I think this should continue. I hope this continues. Wolfgäse meeting is really based on the experience of the people, and it was also fun. So I hope it will continue.